Okay, David, it's a beautiful day and welcome to Voices from Oxford. I thoroughly enjoyed Professor Denis Noble's interview with you. I learned a lot. Okay, my first question is, how does the information you collect benefit patients?
Well, that's really the motivating factor. So producing a new technology is one thing, but if it doesn't help people, then it's very hard to make a case for why it should exist. So improving patient outcomes is really the goal of what we do. And for certainly some of what we were talking about earlier on, what this means is avoiding catastrophe. So providing early warning of problems in healthcare systems can help you get, for example, a doctor to the bedside before it becomes too late. Helps you get a nurse to drive to the patient's home before they get so bad that they would need an ambulance. It's always better to prevent than to treat once it's too late, so to speak. And so really the benefit for the patient is really the driving force of what we're doing there.
I just want to know, you've just used the word catastrophe. What do you mean by that? Pain or death?
Well, a very seriously bad outcome. So it could mean readmission to what's called the intensive care unit in a hospital. So the most serious level of care would be the place where you are sent when you're under emergency conditions. And what we're trying to do is prevent people reaching that stage. So we would like to improve people's health by avoiding those emergencies that would send them to the most serious part of the hospital, intensive care unit. So it's about, can we learn what are the predictive signs of being able to tell when an emergency might happen in the future, so we can avoid them, and that's the benefit for patients. So yes, it means preventing death. Yes, it means preventing emergency situations from arising. It can also mean preventing patients being taken to hospital if they're at home. So avoiding the worst outcomes by intelligent understanding of the patient's health from minute to minute, from day to day.
Do you enjoy the interdisciplinary nature of your work?
Yes, absolutely. That's really a key reason for the success, as I was describing to Denis, of the work, it must be said. So the reason that our systems are caring for 20,000 people every month in the NHS is because we don't work on our own. As an engineer, I know quite a lot about data, and I know quite a lot about computing and forecasting, but I don't know very much about medicine and the care of patients in hospitals. And so it's critically important for my team of engineers and computer scientists to work with medical experts who really have the deep understanding of what it means for a patient to be having an emergency and what steps can be taken to prevent that. So that interdisciplinary nature is a fundamental part, and it really pulls the technologies into the ward. So the reason they're on the wards is because we have excited and exciting clinicians, medics, working with us to get this onto their patients.
So help each other, learn from each other, that's wonderful. Interdisciplinary nature. With big data, how hard is it to sort the wheat from the chaff?
That's a great question. And even understanding what this often heard phrase, big data, means it is tricky. Perhaps turn it round the other way. Let's imagine that we're a doctor in a hospital and we've got page after page of data which has been collected for a patient, perhaps from sticky plaster sensors that they're wearing that are collecting their vital signs. Perhaps there's all the results of all the tests that they've had, and they're all stored in the electronic patient record that exists that the doctor can read in a hospital. Perhaps also we've got genomic data, so we might have sequenced some of the patient's DNA and have an understanding of some of their genomic data as well. This mass of data is not something that we as humans, even the most highly skilled medic, can readily interpret. There's just too much data there for a human expert to be able to understand. Take that, that's for one patient, take that for a whole ward full of patients, a whole hospital full of patients, and you have some idea of the scale of the problem. It's beyond the human expert's ability to cope. Now, we're not trying to replace humans, but we are trying to help them, as you say, separate the wheat from the chaff. Find the important information by fusing this very large quantity of very different, very difficult to read data into something that humans can understand. So making recommendations to a doctor about the condition and the health of their patients is something that computers are really good at doing. Computers can read very, very large quantities of data every second and can learn patterns in those data that might correspond to predicting emergencies. That's the kind of thing that you as a doctor want to know about. You want some help in interpreting that huge, huge library of data that exists for every patient.
What's the balance between the personalized medicine and the privacy?
Yeah, confidentiality of data and to whom does the data belong? That's a really important question. There are practical consequences of insurance, particularly in countries where there's insurance-based medicine, such as the United States. And there's a whole raft of other confidentiality problems as well. Do we want to have researchers poking around with our data, understanding things about us that perhaps we would like to keep to ourselves and so on? Where is the dividing line? How much access to data do you give to scientists like us to be able to make new technologies to help patients? To do that, we need the data. Computing technologies I've described are voracious consumers of data. They require terabytes, huge quantities of data. But every patient, certainly in the UK, every patient owns their own data and is responsible, in some sense. We have to go to every single patient and ask for consent to use their data. So certainly informing the patient about what we're going to do with their data and the limits of what we can't do with their data, that's critically important. I would say one of the biggest steps for privacy concerns is anonymization. So that's taking a library of data from one person and stripping out anything that relates it to a particular individual, making it anonymous, and then the anonymous data set can be secured. It can be secured and stored and used for research, for making new tools and improving healthcare, but where we cannot link those data back to individual patients. So that's another way with coping with the privacy problem. It's something that's ongoing. We haven't solved it yet, but we're iterating towards a system where we can still produce exciting technologies while respecting patient privacy. And it's a balance.
Okay, my last question is the following. We have many young viewers, especially young students, high school students, and undergraduate students. They are watching our programs. Do you have any tips for young students who are interested in your area?
Absolutely. So I would say that the number one tip is be interested. It is a terribly exciting field because we get to work on the latest technology, which is tremendously satisfying from a technology point of view, but you also get to make a big difference to people's lives. And this is something that really captures the imagination of my undergraduate students and school students who come on visiting days to the university as well. Certainly at Balliol we have a lot of open days where we encourage students from across the country to come and listen to what it is that we do, and certainly from interviews on Voices with Oxford and similar, this is a way how lots of our high school students really get some exposure to what it is that universities are doing to give back to society. So it's a tremendously exciting area, and just being interested and being excited and listening and collecting more information and getting involved really just makes the difference. There's so much to be done in terms of the next generation of healthcare technologies. It's a really exciting time for society as a whole. We're trying to work out as a society how to change healthcare, and engineering and computer science has a really key role to play. And I think the students at school and at university who listen to Voices of Oxford are really best placed to be part of the next generation who are able to transform the way we look after our patients in hospitals and at their home.
Thank you very much. Very encouraging comments. And thank you very much for your precious time.
Very welcome. Thank you.